What up, it's your boy, the Surgical Guru. First and foremost, I want to say congratulations to all of the surgical tech students who are now going into externship. I want to give you acknowledgement for deciding to take a step into your future and do something to better yourself and to help your overall life by stepping into a career that can be very lucrative and that can definitely be life-changing. I'm creating this video for all of the students that are going into externship who are looking for some form of advice or tips or wisdom and knowledge as to what they should do in order to succeed in their externship and to ultimately be able to land a job and to walk out of the facility knowing that you are officially employed in your field. This video is 5 tips for surgical techs that are going into externship. By the end of this video, you will be confident and ready to go into externship and conquer and succeed. Tip number 1, ask the doctor questions. When you are in these surgical procedures for the first time that you've never done, the second time, the third time, the fourth time, every time you're in this room, it's an opportunity for you to learn. The doctors and your nurses are storehouses of knowledge, wisdom, and information and experience. And you have to be willing to open your mouth. You have to be willing to ask questions and figure out what's going on. Figure out what anatomy you're looking at. Sometimes you're looking at the monitor and you have no idea what you're seeing. You have to be willing to say, hey, doc, what is it that we're looking at right there? So that the next time that you see it, you can understand what's going on. You have to be able to ask why when you're giving off a suture or you're giving off an instrument and you're like, I wonder why I even gave that to them. Like, I know that that's what they need. That's what my preceptor told me, but why? You know what I mean? They can answer that question for you. A lot of them are very happy to teach what it is that they do. You know, they work with people who see those cases pretty much every day and all the time, who are accustomed to doing it and don't ask as many questions, people who have more experience. So you being someone that's new, it's kind of like, it's exciting for them sometimes to be able to, you know, share their craft and share their passion. So you got to be willing to ask questions. In terms of asking questions to the nurses can help you. I assume that anybody that's going into externship has yet to take their certification exam. So your nurses are also there as a guide and a resource for you. When I was getting ready to take my certification exam, every day I would go into the OR and I would ask questions from my app. I was studying from a MBSTA AST app to help me pass my exam. And if I didn't understand a question, if I read it and I was like, I don't get that, or I don't understand why, I would just ask somebody. I'd be like, hey, what is this? And people were always willing to help. People like to see people who are interested, you know, in their field and in their craft. So make sure you ask questions. Tip number 2, study your cases in advance. The schedule comes out the day before. So let's say, you know, you're going into work on a Tuesday and the schedule's already out. The assignments are already set for the day. What you can do is go to your charge person, go to whoever is in charge in the operating room and ask, hey, what case is it that I'm assigned to tomorrow? What room am I going to be in? Sometimes they might even give you the option to decide what room you want to be in. But if not, then they might be placing you somewhere and figure it out. All right, I'm doing a lap chole. So when you get home, what you need to do is study the anatomy. You know, figure out where's the gallbladder located. I'm taking out the gallbladder. Where is it located? What quadrant is it located in? What are the organs that are around it? You also want to study the case. You want to study the steps. If you can, get the doctor's preference in advance. You know, write the preferences in a notebook. That way, by the time that you get there tomorrow, you have an upper hand. You have an advantage as to already knowing what it is you're going to do, rather than going into the situation and feeling anxious, you know, because you're working on the human body. And I can understand it being nerve-wracking, you can go into it feeling a lot more confident, a lot more ready, and a lot more prepared. And I mean, it looks good on you. Ultimately, the goal is to get hired at the hospital that you're doing your externship, unless you have different plans in mind. But most people usually want to get hired at the hospital that they did their externship at. So just being prepared goes such a long way. It shows that you care about your job. It shows your professionalism, and it shows that you want to be the best that you can be, and that you're an asset to that hospital, and you're an asset to the company and to that OR department. So definitely make sure you study your cases before you go in the next day. Tip number 3, master sterility and scrubbing, okay? Before you go to your externship, the 2 things that you want to have down packed is your scrubbing and your sterile technique. When you're in the room, keeping your hands right, not contaminating. Granted, everybody makes mistakes. Everybody contaminates things. It happens to every single surgical tech and pretty much everybody that works in the operating room. But you don't want to go in there feeling completely clueless when it comes to sterility and when it comes to scrubbing. That's a good way for you to get kicked out of a room, and that's a good way for people to look at you and feel like you don't know what you're doing. In terms of the doctor's preferences, the steps of the procedures, all those things are going to take time to learn. And no matter where you go in your career, people's preferences are different. Everyone uses different things. You know, there's many different ways to skin a cat, and everybody feels like their way is the right way. So you're always going to be learning people's preferences. That's just how it is throughout your whole career. But in terms of sterility, in terms of scrubbing, those are your main 2 priorities as a surgical tech. And, you know, if you can at least do that, then you can make your way into any room and be able to observe and ask questions and learn the procedures. And that's ultimately what you want to do. So yes, sterility and scrubbing, that's very important. Tip number 4, an eagerness to scrub everything. We live in a generation now where, I don't know, I could be wrong, but it seems like a lot of people would rather be pigeonholed into one specialty. They would rather do what it is that they're comfortable doing. You want to be the type of person where you're open to doing everything. Of course, you want to master different things, but as a tech, you want to be that type of tech where you can do anything. Those are the techs who are most respected, where you can put them into any room and they can get the job done. So the only way that you're going to be able to do that is to not be afraid. You gotta jump in, and any opportunity that you have to scrub procedures, don't tell people, oh, I don't want to go in there with that doctor, or I'm nervous, or I'm afraid. You just have to conquer your fears, and you have to take on the challenge. And ultimately, it's going to make you the best surgical tech that you could possibly be. And tip number 5, avoid drama, gossip, and negativity. People who have been at a particular job or have worked in that department or hospital for a long time, they tend to get pessimistic, negative. I mean, when you're somewhere for so long and you see the ups and downs of a department, people come and go, I think it's easy to develop a sense of just negativity. And as a new person, you don't want to fall into the trap of cliques. You don't want to fall into the trap of talking negatively and gossiping about other people. It's not healthy, and that's not what you're there for. Ultimately, you're there to take care of patients, and you would want people to be focused on taking care of you rather than creating unnecessary drama. I don't know how much more I could say about that, but the people that I respect most in this field are the people who are there with a goal and a purpose and are not there to talk down on other people. We're way too old for that, man. Like, we're adults, So focus on what's most important. And when you see people talking negatively, you don't want that type of energy to rub off on you. You don't want those words to sink into your subconscious mind. So just distance yourself, go into another room, learn something. Stay around the positive people, the people who are going to help you elevate yourself and become the best version of yourself. All right, and we got a couple bonus questions and extras. So the next one is going to be know your instruments. It's very impressive when somebody that's new, just coming out of school, knows their instruments very well. There's so many different categories of instruments and different trays that are available in sterile processing for you to go through, for you to study. Go talk to the people in sterile processing. When you're done your cases for the day, let's say you have a day where you get out of your room with enough time for you to be able to go to sterile processing and to study your instruments. You gotta do that. You wanna make sure that you know what's going on. That goes right along with asking questions. I would definitely recommend going to sterile processing. I used to do it all the time. I used to go and just help them put trays together because I knew that putting the trays together, going through the pick sheets or the list that all the instruments are on, like the forget what the list is called, but the list that comes with the tray that has all the names of the instruments. Yeah, you want to keep going through that. You want to study it every single day. Whatever your weak suit is, there's vascular instruments there's so many different clamps that are in vascular that are very technical. Go study those. Go study the orthopedic instruments, the instruments that are in the total knee tray and the total hip tray. There's so much you could learn, and you want to be the type of person who's learning something new every single day. When we scrub in for cases and we hand off that tag to spin, if you're able to keep that tag sterile by spinning with somebody who's sterile, use that tag, write things down on it, write notes, write what you're weak in, write how you need to improve. Ask your preceptor, how can I improve? What can I do better? What could I have done better during that case? Could I have anticipated better? Could I have, been a little bit quicker with passing off instrumentation? Could I have loaded my needles better? Could I have handed off my sharps better? All these things are building blocks which are going to make you the best surgical tech that you could possibly be. Another bonus, a friend of mine recently just told me about the 3-second rule. When a doctor asks you for an instrument and they put their hand out and they're waiting for it, you don't want it to be any more than 3 seconds before you get them that instrument, especially when you're brand new. When you're a little bit more seasoned and a little bit more comfortable with the doctors, and sometimes maybe it could take you a little bit longer, or you can, but even then, the goal is to get the patient off the table as quickly as possible so that they receive the least amount of anesthesia, so that we're spending the less amount of money that we need to spend. And you just want to get in and get out. Who wants to be in a long surgery, And that really, part of it comes down to you. It comes down to the surgeon that's operating, but it also comes down to how quickly you have your things ready, the instruments that are ready, that are going to be used, having them readily available on your Mayo stand, and taking things off of your Mayo stand, putting it back onto your back table when you're done with it. These are all things that are going to help the case go as quickly as possible. You need to constantly just be moving, preparing, thinking, anticipating. What does he need next? What does he need next? All right, we're at this point. Oh, you're going to need a suture. Oh, you're putting in a drain. Oh, you're going to need a drain stitch. Hey, nurse, can I get a drain stitch? All these things are going to save valuable time. And 3-second rule. Get it to them as quickly as possible. Handling sharps safely. That's so important. What easy way to rub someone the wrong way than to poke them with a knife or a suture? You gotta practice as much as you can. Practice loading sutures, and then practice handing it off. Practice, just putting it into somebody's hand. Sometimes I even practice in my own hand, just doing this with an instrument over and over and over, just to get used to the motion. And you want to make sure that when you're handing off a blade, that the knife is away from the person that you're handing it to. You don't want to hand them the blade with the blade facing them. You don't want to hurt anybody. That's not what we're there for, you know? So you got to be really careful with sharps, and, you know, you don't want to hurt yourself with anything that's dirty, and we're not there to get ourselves sick or to make anybody else sick. We're there to help patients. So handling sharps, you know, if you have any questions as to how to do it better, sometimes it's a little bit difficult. It's a bit of a challenge when you first get out of school. So if you want to know how can I do this better, you just ask the resources that you have. The people are there for you, and they've been doing it for enough time to where they can help you and guide you on the right path. And this is my last bonus question. I saved this one for last because not everybody is going to do this. Dress for success. You know, if your goal is to get hired at the hospital that you're doing your externship, if that's an ideal job for you and you want to be there long term, or even if you just want to make an impression on people, I mean, ultimately you're networking. Everywhere that you go, you have an opportunity to meet people. These people might have worked at other places. They might know managers to other places where they could put in a good word for you, or these people can write you a letter of recommendation. I think that dressing for success shows that you take yourself seriously. It shows that you respect yourself. You know, most people come in with regular clothes. You know, it's early in the morning. We're going to change into scrubs anyway, so who cares? You know, people put on regular clothes, they go. I've even gotten into the habit of just wearing regular clothes because it's just easier. At the end of the day, I don't have to change again when I get home. You know, I just wear what it is that I'm going to wear, some shorts and a t-shirt. But when I first started in this field and I was on my externship, I used to always dress up. I used to always wear a dress-up shirt, a tie, some slacks, some nice shoes. And it made an impression. It made an impression. People notice that. People see that this guy is serious about his life and his future. And it might not get you the job. You know, let's say that they don't have a position open in the operating room. Shoot, maybe it'll get you a position in sterile processing. That's what happened for me. You know, I didn't have a job as soon as I got out of school. I had to wait a little bit. It took me about 6 months. Sometimes when you're fresh out of school, hospitals aren't really eager to hire you. They might be looking for somebody with more experience. So something like that, dressing up, just might give you the edge over the other students who might not be doing that, you know? So whatever it is that you can do in order to make yourself stand out and to be the ideal candidate and quality for a position at that hospital, I definitely recommend you do it. And that's it. I had a couple extra, but those are 5 tips for surgical tech students who are going into externship, who are looking to get hired at the hospital where they will be doing their clinicals. I wish you guys much success. I wish you guys much love and much blessings. Please let me know if you have any questions. I will be doing my best to get back to all the questions that you have. I want to thank you guys for watching. I want to thank everyone that's subscribing and all the support and love. And, you know, I hope that this content is helping someone out there. If it can help at least one person, then I will have done a good job. So much love, much peace. It's your boy, the Surgical Guru.